Thank
You
you.
can carry on.
Hi,
Thank you
hi.
very much.
Hello to
Thank you.
everyone, and thank you from you and from others. And I will start in the name of God. Good morning, ladies and gentlemen. My topic about the skeletal system, but basic of the skeletal system that I'm sure all of you study about it in the anatomy, and we will review it together. The skeletal system, parts of the skeletal system, what is that? It is the bones, joints, cartilage, ligaments, that in the ligaments we have the bone to bone, and in the tendon we have the bone to the muscles. And also it is divided into the two visions, axial skeleton and appendicular skeleton, that it's divided to the limbs and girdle. Here we saw the axial skeleton, skull, and also rib cage, and also you see in this picture the vertebral column, the ribs, and also the skull. If anybody can like it, can take the screenshot from our photos. About the functions of bones: support of the body, protection of soft organs, movement due to attached skeletal muscles, blood cell formation, and also storage of minerals and fats. Bones of the human body. You know the skeleton has 206 bones, but in the adult human persons, and we have two basic types of bone tissue, compact bone and spongy bone. In compact bone, we have the homogeneous, and in spongy bone, we have small needle-like pieces of bone and many open spaces. As we see in this picture, we have the spongy bone, look, and the compact bone. At this side, the compact bone is more harder than the spongy bone, and we have the space between the spongy bone. You can see in this picture. The classification of bones on the basis of shape. We have the flat bones, irregular bones, long bones, short bones, and we will take the example for each of them. The long bones, typically longer than wide, they have a shaft with heads at both ends, and also they contain mostly compact bone, as like as a femur, as like as a humerus. Here we see humerus, radius, ulna, metacarpals, metatarsals, phalanx, fibula, tibia, and femur. About short bones, they are generally cube-shaped. They contain mostly spongy bone, as like as the carpals and tarsals. Look, carpals and tarsals in the hand and in the foot. About the flat bones, they are thin and flattened. They usually curved and thin layers of compact bone around the layer of spongy bone, as like the skull, ribs, sternum, cranial bones, sternum, scapula, and our ribs. Irregular bones. They have an irregular shape, as like as their names. They do not fit into other bone classification categories, as like as a vertebra and hip. Vertebra and sacrum in the hip. The axial skeleton forms the original parts of the body and also divided into the three parts: skull, vertebral column, and also bony thorax. The skull is two sets of bones, cranium and facial bones. Bones are joined by sutures. Only the mandible is attached by freely movable joints. Here we saw the skull here and also some suture. We know all of us. We have the four suture: coronal suture, lambdoid suture, squamous suture, and also sagittal suture. As you see here, frontal bone, sphenoid bone, ethmoid bone, lacrimal bone, nasal bone, zygomatic bone, maxilla, alveolar margins, mandibula, mental foramen, mandibular ramus, styloid process, mastoid process, external auditory meatus, zygomatic process, Ischium suture we have here. This is the occipital bone, lambdoid suture, temporal bone, and parietal bone. And this is the anterior view of that. We can see all of them also in the anterior view. And it is a superior view. Frontal bone, cribriform plate, and crista galli, that both of them in the ethmoid bone, sella turcica, foramen ovale, jugular foramen, foramen magnum, occipital bone, parietal bone, and internal acoustic meatus, temporal bone, and sphenoid bone. And this is the inferior view. Hard palate that's divided into the maxilla-palatine process and palatine bone, zygomatic bone, temporal bone, vomer, mandibular fossa, styloid process, mastoid process, temporal bone, parietal bone, foramen magnum, occipital condyle, jugular foramen, carotid canal, foramen ovale, sphenoid bone, and maxilla. About the paranasal sinuses, there are hollow portions of bone surrounding the nasal cavity. And also we saw here frontal sinus, they are above the eyes, sphenoid sinus, they are behind the eyes, ethmoid sinus behind the eyes, sphenoid sinus, and also maxillary sinus, they are down of the eyes, under the eyes. And this is the side of that, sphenoid sinus, frontal sinus, ethmoid, and maxillary sinus. And what is the function of that? They lighten to the skull and also give resonance and amplification to the voice. Our hyoid bone. This is the only bone that does not articulate with another one. It serves as a movable base for the tongue. Here, see. And we zoomed here. Greater horn, lesser horn, this is the body. The fetal skull is the large compared to the infant's totally body length. You see this here pictures, frontal, parietal bone, and posterior fontantal, and this is the side of it. And also, spontaneous fibrous membrane connecting the cranial bones allow the brain to grow and also convert to bone within 24 months after birth. Vertebral column. The vertebra separated by intervertebral discs we saw here. And the spine has a normal curvature. Each vertebra is given a name according to its location. For example, we have the cervical curvature C1 till C7, and don't forget we have the 8 nerves here. Thoracic curvature T1 to T12, lumbar curvature, and sacrum. These are 5, and coccyx, 4 fused vertebra that we have the 1 nerve passed from here. About the structure of a typical vertebra. Here we saw the anterior side, posterior, spine's process. Here is posterior and anterior. In the anterior we have the body, vertebral column, vertebral arch. In posterior we have spine's process, lamina, transverse process, superior articular process, and pedicle. The bony thorax, it forms a cage to protect major and important organs, as like as the heart, as like as the lungs. And you see here T1 vertebra, jugular notch, clavicular notch, manubrium, sternal angle, body, the sternal joint, xiphoid process, but these are all of them from the sternum, true ribs, it's 7, false ribs from 8 till 12, and floating ribs, they are free, 11 and 12. And these are the intercostal spaces between the ribs. And these are made from the costal cartilage, not bone. And they are made of 3 parts, sternum, ribs, and thoracic vertebra, as I told. And the appendicular skeleton, it is divided to the limbs, pectoral girdle, and pelvic girdle. You saw here shoulder girdle, arm, hand, pelvic girdle, and foot and leg. The pectoral shoulder girdle is composed of two bones, clavicle and scapula. The other name clavicle, collarbone, and scapula, shoulder blade. These bones allow the upper limb to have exceptionally free movement. Here, we saw the bones of the shoulder girdle, scapula, humerus, that we have here acromioclavicular joint, look, between the clavicle and the humerus. And also, we saw the superior view, we have the posterior view, medial end, lateral end, acromial end, sternal end, and don't forget, this is the right clavicle. Totally show it here. Bones of the upper limb, the arm is formed by a single bone, humerus. We saw the humerus bone here. Look, head of the humerus, greater tubercle, lesser tubercle, anatomical neck, intertubercular groove, deltoid tuberosity, radial fossa, coronite fossa, capitulum, trochlea, lateral epicondyle, olecranon fossa, and here we have the medial epicondyle. Why we say the medial? Why we say the lateral? We say medial because it's center of the body, near of the center of the body, because of that. And the forearm has two bones, ulna and radius. Head, neck, radial tuberosity, radius, styloid process, ulna. Interosseous membrane we have here, distal radio-ulnar joint, trochlear notch, olecranon process, coronite process, and proximal radio-ulnar joint. The hand, divided to the carpals, metacarpals, and phalanx. Carpals, wrist, metacarpals, palm, phalanx, fingers, phalanx. Look, our fingers here, distal, middle, and proximal. Distal, middle, and proximal. We have the metacarpals, 5, and carpal, the other name is wrist. Hamate, pisiform, triquetral, lunate, ulnar radius, the triploid, trapezium, and scaphoid, and capitate. Hip bones. It composed of 3 pairs of fused bones, ilium, ischium, pubic bones, and the total weight of upper body rests on our pelvis and protects several organs, reproductive organs, part of large intestine, and urinary bladder. The pelvis, look here totally, this is the coxal bone or hip bone, ilium, pubic bone, ischium, sacrum, coccyx, pubic arch, pubic symphysis, acetabulum, pelvic brim, ischial spine, sacroiliac joint, and iliac crest. Gender difference of the pelvis. What is the difference between the male and female pelvises? Pons pelvises. Look, inlet of two pelvises. You see here pelvic brim and pubic arch. You see here in the male is lesser than female. For example, in male is less than 90 degrees, but in the female it's more than 90 degrees. You saw here, look. And pelvic brim, inlet of two pelvis, look. They have a difference. The male is smaller than the female. The thigh has one bone, femur, thigh bone, neck, head, greater trochanter, intertrochanteric crest, lesser trochanter, gluteal tuberosity, intercondylar notch, lateral condyle, medial condyle, and lateral condyle and patellar surface. We saw lateral because it's far away from the center of our body. The leg has two bones, tibia and fibula. Fibula, tibia, anterior crest, interosseous membrane, medial condyle, tibial tuberosity, intercondylar eminence, lateral condyle, head, proximal tibiofibular joint, medial malleolus, distal tibiofibular joint, and lateral malleolus. The foot. It's divided to the tarsus, metatarsals, and phalanx. Tarsus, ankle, metatarsal, sole, and phalanx, toes. Phalanx distal, middle, and proximal. These are the metatarsals. Metatarsals, it is the lateral cuneiform, cuboid, medial cuneiform because near the center of the body, intermediate cuneiform, navicular, talus, and calcaneus. About the gross anatomy of a long bone. Diaphysis, epiphysis. Diaphysis, it is a shaft composed of compact bone, and epiphysis, ends of the bone, and composed mostly of spongy bone. Yes, what happened?
Sorry for the interruption. There is some comments like you should be a little slow down. Talk slowly. People couldn't catch your point. Could you slowly? Yeah, could you speak slowly? That will be appreciated.
Okay.
Yeah, could you speak slowly? Yep. Thank you. Thank you very much.
Thank you. Proximal epiphysis, diaphysis, and distal epiphysis we saw here. Spongy bone, articular cartilage, epiphyseal line, and periosteum we saw here. Compact bone and medullary cavity. Look, the compact bone, it's more harder than the spongy bone. The structures of a long bone: periosteum, sharp spheres, and arteries. In the periosteum, outside covering of the diaphysis, fibrous connective tissue membrane. In sharp spheres, secure periosteum to underlying bone, and arteries supply bone cells with nutrition. Look at the arteries. They are nutrition arteries that give the nutrition to the bone. Yellow bone marrow, endosteum, compact bone, periosteum, sharp spheres, and nutrition arteries, as I told. Articular cartilage covers the external surface of the epiphysis, made of hyaline cartilage, and decreases friction at joint surface. Proximal epiphysis, diaphysis, and distal epiphysis. Spongy bone, that I explained before: articular cartilage, epiphyseal line, periosteum, compact bone, and medullary cavity. Medullary cavity, it is the cavity of the shaft. Contains yellow marrow in adults. Contains red marrow for blood cell formation in infants. In adults, mostly fat it is contains. And bone markings. Surface feature of bones, sites of attachment for our tendons, ligaments, and muscles. And also from these markings, passage for nerves and blood vessels. And also the categories of bone markings: projections and processes, and depression or cavities. For the projection and processes grow out from the bone surface, depression or cavities, interjections. About the microscopic anatomy of stone Haversian system. This is a unit of bone, central Haversian canal, opening in the center of any stone, and carries blood vessels and nerves. Perforating Volkmann's canal, canal perpendicular to the central canal, and carries blood vessels and nerves. Here we saw the picture. Lamella of stone Haversian system, and we zoom it too much. Lamella, osteocyte, lacuna, canaliculus, central Haversian canal, matrix. Here we saw the blood vessel contains in the medullary cavity containing the marrow, spongy bone, central Haversian canal, perforating Volkmann's canals, blood vessels, contact bone, sharp spheres, this over here, and periosteum. We took it this slide from a little bit the bone. And this is a microscopy. We saw it, also we studied in the histology, canal, lamella, and interstitial system. Lacuna, cavities containing bone, cells, osteocytes, and arranged in concentric rings. Lamella, rings around the central canal and sides of lacuna. Lamella, osteocytes, lacuna, canaliculus, central haversion, and matrix. Canalicular tiny canals radiate from the central canal to lacuna and form a transport system. Change in the human skeleton. In embryos, the skeleton is primarily hyaline cartilage. It means first of all, it is the hyaline cartilage, and after that it grows. During development, much of this cartilage is replaced by the bone, and also cartilage remains in isolated areas, bridge of our nose, parts of ribs, and joints. Epiphyseal plates allow for growth of long bone during childhood. New cartilage is formed and older cartilage becomes ossified. Cartilage is broken down and the bone replaces the cartilage. Here, we saw the formation and growth of lung. In an embryo, we have bone starting to replace the cartilage. Here we saw the bone a little and hyaline cartilage model. This is in an embryo. In a fetus, we saw the new center of bone growth. Hyaline cartilage, medullary cavity, blood vessels, and at this site we go blood vessel, epiphyseal plate cartilage, articular cartilage, spongy bone, new bone forming, growth in bone white, a little bit being white, it grows to the whitely, and this is in a child. And here we have an epiphyseal plate cartilage and new bone forming here. Types of bone cells: osteocytes, osteoblasts, osteoclasts, and also in the osteocytes we have the natural bone cells, osteoblasts, bone forming cells, and osteoclasts, bone destroying cells, and break down bone matrix for remodeling and release of calcium. And the bone remodeling is a process by both osteoblasts and osteoclasts. Bone fracture. A break in a bone. Types of bone fractures: closed fracture and open fracture. Closed fracture it is simple, and the open fracture is compound. In the simple closed fracture, we have broke that does not penetrate the skin, but in the open, the broken bone penetrates through the skin. And also bone fractures are treated by reduction and immobilization. Realignment of the bone. That orthopedic doctors do it. Common types of fracture we saw here: comminuted, compression, depressed, impacted, spiral, and green stick. In the description, comminuted bone breaks into many fragments. Bone is crushed, osteoporotic bones, and broken bone portion is passed inwards and depressed. In impacted, broken bone ends are forced into each other, and the spiral ragged break occurs when excessive twisting force are applied to a bone. And in green stick, the bone breaks incompletely as a way of green adults. And these are the common in the age. Tooth bones are more brittle, common in porous bone, typical of skull fracture, and so on. Repair of bone fractures. Hematoma, blood-filled swelling that is a form. Then break is splinted by fibrocartilage to form a callus. Fibrocartilage callus replaced by a bone callus, and bone callus remodeled to form a permanent patch. You see in this picture, hematoma formation, saw the hematoma, internal cells, fibrous tissue and cartilage, new blood vessels, external callus, that this side, fibrocartilage callus formation, two bony callus formation, we have the bony callus of spongy bone, and the A, bone remodeling, means heal the fracture. About the joints, articulation of bones. The function of joint, they are hold bones together and allow for mobility, movement. These joints are classified functionally and structurally. In the functional of joints, we have synarthrosis, amphiarthrosis, and diarthrosis. In synarthrosis, these are immovable joints. Amphiarthrosis is slightly movable joint, and in diarthrosis, they are freely movable joints. Fibrous joints, that the bones united by fibrous tissue, synarthrosis, or lightly immovable. Here we saw fibrous connective tissue, and in the humerus we have the articular hyaline cartilage and scapula. Shown here. The cartilaginous joint, mostly amphiarthrosis, bone connected by the cartilage. Look, these are the vertebra and fibrocartilage, and like as examples, pubic symphysis, intervertebral discs, and pubis and fibrocartilage. They are connected to bones or some bones by the cartilage. Synovial joints, their articulating bones are separated by joint cavity, and synovial fluid is found in the joint cavity. Here at this picture, articular hyaline cartilage, articular capsule, ulna, radius, articular capsule, carpals, tibia, fibula, fibrous connective tissue. Features of synovial joints, diarthrosis. This is articular cartilage. Hyaline cartilage covers the ends of the bones. Joint surfaces are enclosed by a fibrous articular capsule, have a joint cavity filled with synovial fluid, and ligaments reinforce the joint. Structure associated with synovial joints. Bursa, flattened fibrous sacs, lined with synovial membrane, filled with synovial fluid, and not actually part of the joint. And in tendon sheath, elongated bursa that wraps around the tendon. We saw the synovial joint here. Acromion of scapula, ligament, bursa, ligament, tendon sheath, tendon of biceps muscle, humerus, fibrous articular capsule, synovial membrane, articular hyaline cartilage, and joint cavity containing synovial fluid. Types of synovial joints based on shape. The plant joint, hinge joint, pivot joint. We saw carpal between ulna and humerus, the hinge joint, pivot joint between the ulna and radius. Look, this is the shape of that. And condyloid joint, saddle joint, and also ball and socket joint between the head of humerus and scapula, carpal and metacarpal, its saddle joint, the example of that, and metacarpal and phalanx, condyloid joint. About inflammatory condition, that these are the diseases associated with the joints. Bursitis. What is that? It is the inflammation of a bursa and usually caused by a blow or friction. Tendonitis. It is inflammation of tendon sheaths. Arthritis. It is inflammatory or degenerative disease of joints that over 100 different types, most widespread crippling disease in the United States. What about your country? Clinical forms of arthritis: osteoarthritis, rheumatoid arthritis. Osteoarthritis, this is most common chronic arthritis and related to normal aging processes. And in rheumatoid, this is an autoimmune disease. Our immune system attacks our joints, and symptoms begin with bilateral inflammation of certain joints and often leads to deformities. Gouty arthritis. Inflammation of joints is caused by deposition of urate crystals from the blood and also usually can be controlled with our diet. Guys, really thanks for your attention and our presentation finished.